Hello everyone, welcome to Medcampus. In this video, I'll be discussing this important topic from pharmacology, the general pharmacology part, that is prescription writing and what are the prescribing errors. Of late these days, in the medical PG entrance examinations, there were questions from this general aspect. And as a clinician or a physician, it is vital for you to know what is an ideal prescription writing and what are the errors that you should avoid during your practice, right? So along with importance in terms of MCQs for PG exam, this topic also carries importance in terms of your clinical life, right? So please focus on this. So I'm taking reference from various resources along with the major sources, the Katzung's pharmacology textbook, the latest edition. In that it is clearly given, there is a separate chapter wherein you need to understand what is rational prescribing and what is the ideal prescription writing. So definitely I'm not going to give you what is the form or the common letterhead that you should use. I'll not go into the details, but I'll quickly tell you it should contain the name of the doctor. Okay, if you're freshly starting your own clinic or you're compiling your own prescription pad, it should contain name of the doctor, very importantly mobile number, because in case if at all if the pharmacist want to reconfirm that you have prescribed this medicine to particular patient, he can call on this number. At the same time, if the date should be there, and if the date is 2 years back or 3 years back, the pharmacist might reconfirm whether it is a kind of latest prescription or off-label or off-late prescription, right? So name of the doctor, mobile number and address of the clinic are very important here, okay, when you start giving it. And name of the patient, it should contain name of the patient. And an ideal prescription should always have provisional diagnosis or final diagnosis, because this is very important. You cannot prescribe any medication without knowing a proper diagnosis, right? So the provisional diagnosis. Then we have the drug name, the drug name of the drug, ideally the generic name. There's no harm in writing brand name again, but the handwriting should be legitimate. Name, dosage, very important one. Route of administration, route of administration, this is very important. And one more thing is, what are we missing? Route of administration, dosage, schedule for how many days, whether to stop or whether to continue or when to come back or follow up, and all. Any special precautions, maybe before meals or after meals or on empty stomach or after medication, stand for 30 minutes as we do in bisphosphonate therapy, right? So these are the important things that should be there. Okay, quantity, strength, dosage, route of administration, schedule and all should be written, and when to stop the drug, and the follow-up part. Now at the end it is very important to sign it, okay, and also mention your license number, okay, medical registration number with medical association, right? So the license number should be mentioned in a prescription form. So this is an ideal prescription form. Now whenever you're prescribing a drug to any patient, it is prone for errors, okay? So there are different classifications for prescribing error. I'll give you the simpler form. What are the prescribing errors? So one prescribing error is omission error. So what kind of error it is? So in this, what you are doing is, instead of prescribing a drug, you are, for example, let's assume that the case sheet or the case book is over and somehow the duty doctor forgot to enter a drug even after advice. So you're not entering a drug from previous. For example, it is 12/09/2022. From there on 13/09/2022, someone might have forgotten to enter the drug. So this is omission error. So to avoid this, you should never write repeat. Okay, repeat. You have to enter the drug schedule again, and you have to check for the referral list. So whenever you refer a patient, the referral doctor or specialist might have advised an important drug. You have to check the referral and write the drug again. So don't just write the repeat the same drug or repeat the same dosages, because the nursing staff might get confused and they completely omit the drug. So this is omission error. Second thing is commission error. So even if the drug is not prescribed, sometimes there is a chance that you might it might be there in the prescription pad. Okay, you have to be very careful in that. The one more very common is dosing error. Okay, you have to be very careful. You have to look at the renal state of the body. Okay, the drug excretion and all. There are various factors on which the dosage depends. Okay, so if the drug is given an incorrect dose, we call it as dosing error. And the drug frequency error, sometimes for example, Pantop is written BD when Pantop OD is more than enough. There are some drugs which are enough. For example, azithromycin BD, azithromycin OD, or single dose of azithromycin is enough, right? So you have to be very careful with that. And we also have substitution error. Instead of giving one drug, you might get confused and write something else. For example, you very closely related drugs with close name like acetazolamide. So acetazolamide is given for glaucoma, right? So acetazolamide is given for glaucoma. There is closely related drug like acetohexamide. What is this? Acetohexamide. So the substitution error might occur. Similarly, we have methotrexate, and we also have another drug, metolazone. Okay, metolazone. So don't get confused with this. For this, what you have to write is, whenever there's a drug confusion, you have to write acetazolamide for glaucoma. You can even mention indication to avoid confusion. Okay, so and one more thing is duplication error. You might be giving same two NSAIDs at the same time when they have same function, right? So it's a duplication error. These are the basic prescribing errors. But what is more important for exam point of view is the symbols what we use. The symbols what we use. Please, your handwriting should be legitimate. It should be clear. Okay. And one more important thing is decimal point. You should be careful while giving decimal point. For example, if there is 1.0 mg, you might get confused it as 10 mg. So there is a big risk here. Similarly, if there is 0.1 mg, fine, but instead of mentioning that, if you only mention decimal 0.1 mg, there is confusion. The nursing staff might think that it's 1 mg. So you have to be very careful while giving. And similarly, you shouldn't be using units, U symbol. Never ever give this. For example, if you're prescribing insulin 40 units, okay, when you're giving insulin 40 units, do not mention it there as U. Don't make that silly mistake. Even when you're giving heparin in units, write the full units, because sometimes we may get confused that it is 100. So units should never be mentioned as U. You have to completely mention it as units. In case of, usually where do we write it? In case of insulin, and also in case of subcutaneous heparin, whenever we advise units, you have to mention it as units, not as U. This is very important one. So we are done with the decimal point. You should be very careful. Not 0.1 mg, 0.1 mg, not 1.0 mg. It is 1 mg. Okay. This is one very important thing you should be pretty careful about. And one more important thing is, do not mention OD. OD is not once daily. OD means in the literature, it is right eye. Please be careful. Okay. So once daily, you have to write it as once daily. Actually, once daily we use QD, but problem with QD is you also have QID, that is 4 times daily, and you also have QOD. What is QOD? Means every other day, or every alternate day, or every second day. So that's the reason, avoid QD. OD, many of us, even I don't know, for a particular reason, nobody taught me that OD means right eye. OD means not once daily. If you want to write once daily, go for QD, but again, most of the standard literature advises you not to write it as QD, just mention once daily. The reason being, QID is 4 times daily. You might get confused, or QOD is every other day. So there is a confusion around it. This is the third important take home for you. So do not write OD, always write once daily. So decimal point is done, the units point is done, and the third thing is this thing. And do we have anything else you have to be very careful about? Yes, there are other ways. One more fourth important thing is, when you are giving syrup, okay, don't mention TBSP or TSP or capital T. So these are the usual things we write. Tablespoon, tablespoonful or teaspoonful. What is the difference between these two? Tablespoonful means 15 ml. Teaspoonful means 5 ml. So now you see the confusion. If you mention it as TBSP or TSP, the patient will get confused. He don't know whether to take 5 ml or 15 ml because teaspoon is different from tablespoon. Tablespoon is a bit bigger one. So do not mention TBSP or TBSP. You have to write tablespoon 15 ml or teaspoon 5 ml. You have to write it. So do not use these symbols. Very important ones. Very important. Okay. And one more fifth take home for you is the basic prescribing error is do not write microgram like this. When you're writing microgram, put it like this, microgram. The problem here is you might think that it is mg. Okay, so the patient is getting almost 1000 times the bigger dose. That's the problem. So whenever there's a microgram, do not mention it like this. You have to write it full like microgram. Okay, this is one more important precaution that you need to take while giving prescription. So with this 5 important things, okay, the background knowledge, I'll give you some usual symbols which we use for prescription. This might help you because many of us sometimes get confused whenever we enter internship. We see a lot of these shortcuts and we get confused. When I say PO, PO means per mouth or per oral. Okay, PO means per mouth or per oral. PR means per rectum. Okay, these are important when you're practicing, when you are doing your posting. This should help you. Okay, and these are the common things. There are various, almost 50, 60. I'll not give you that, but the commonly used one, SOS. SOS means if needed. The same thing is PRN, that is when needed. We usually don't use this. Commonly used one is SOS. Okay, please be careful with that. So we have cap, we have tab, capsule, tablet. So some like amoxicillin is only available as a capsulated form. You cannot write tablet amoxicillin. There are some drugs which are in capsulated form. There are some drugs which are in tableted form. You have to be very careful while prescribing that. This is one more important thing. Okay. So when you're writing gram, you mention G. Okay, gram, not GM. GM is not gram. Okay, you have to mention G. Be very careful with that. G. And HS. What is this? HS, very important one. Bedtime. HS means bedtime. HS means bedtime. Please be very careful because we also have QHS. What is this? QHS. Every night at bedtime you have to give the dosage. Similarly, if I give Q2H, that means every second hour. Every second hour. If I say QID, it is every like 4 times daily. QID means 4 times daily. Okay. So this is one thing you have to be very careful. Do you have any important ones? IV, IM and all, you know, right? I don't need to mention all those things. And one more thing, as I told you, OD is not once daily, it is right eye. Then what about left eye? What about left eye? Do you know what do we do? What do we call it as left eye? Because we use it for whenever we prescribe eye drops, we use it. We call it as OS or OL, anything, left eye. OS or OL is for left eye. OS or OL is for left eye. So these things are more than enough for you now. Okay. There was one more thing. Stat. Stat means at once. You can use all these things. You can use all the symbols which are given here, but you cannot use OD or QD for once daily. As I told you, you cannot use U. You have to use units. You cannot use microgram. You have to write it as micrograms because there's chances that get confused. Tablespoon, TBSP and all. You have to be very careful. You have to be very careful. These are the common prescribing errors.